All right. Hi, everyone. Thank you so much for being here for our Expand Ed Talk hosted by the Center for Innovative Research and Change, Leadership, and Education. None of you need to remember that. We go by Circle. I'm Jessica Gottlieb, the director of Circle, and I am delighted to introduce Dr. Kate Kennedy. She's an assistant professor of educational leadership and policy studies at the University of Cincinnati. She completed her PhD in urban education policy at the University of Southern California, and her research focuses on organizational management and change, care, and the politics of education, all with an eye towards access to high quality learning for all students. We are delighted to hear about some of her more recent research focusing on caring and the role of school and district leadership. And with that, I'll turn it over to Dr. Kennedy. You are welcome to leave comments in the chat. We will also leave a lot of time for Q&A at the end.
Awesome. Thanks so much for the warm introduction, Jessica. First question, can you see my slides?
Yes,
Great.
looks
Okay,
great.
I'm off to a good start already. It's so nice to see you all here. Thank you for joining us during your lunchtime or whatever time it is where you are. So I already was introduced, but this is me. I'm not very active on the socials, but I'm sometimes on LinkedIn if you feel like connecting that way. I want to kind of hear who's in the room, talk a little bit about the research on care. This is my cat, Razzie. She loves to join the party. Talk about the evidence base for caring school systems, and then close thinking about some implications for policy, practice, and research. And so, if you wouldn't mind, since I'm talking about care, and I'm delighted to talk about this subject with you all for Texas Tech, if you could take a minute and just in the chat, your name, where you're located, and then how you define or think about care from whatever perspective you're coming from in your job and your home life. And I will introduce myself in the same way. So, Kate Kennedy. I'm fortunate enough to be housed at the University of Cincinnati, and I'm Zooming to you today from my home in Columbus, Ohio, where it is raining. And I think a lot about care. I have the privilege of doing so. A lot of this stems from my work as a middle school teacher for 10 years, also as a director of professional learning and a coach for teachers and leaders. So I think about these things from a number of different perspectives and ways, but I always try to keep my students in mind. So those are some pictures from my classrooms. I earned my PhD in urban education policy, and I currently teach in the principal leadership and urban educational leadership programs. Those are doctoral and master's programs at the University of Cincinnati. And I take seriously my role at a public research university and kind of position myself as a scholar activist. This is from our new collective bargaining agreement with the AAUP. It's a lot of text, but essentially it positions us as academics as contributing to a democracy by engaging with a continual flow of new ideas and positions us as people who are asking hard questions. And so I think about this a lot when I think about why care, why does it matter? And so I just wanted to start with that. I've been meditating a lot on this, as I'm sure many of you have. And I sort of work across three strands. The first is what I'm going to be talking about today. I think a lot about caring policy and leadership, and these are some of my papers. I also think a lot about equity and how it shows up in research, policy, and practice. And I'm very interested in school systems as organizations and how they function as caring places. And so this is some of the work I'm going to share with you. And this journey really began because as a teacher, I noticed we were focusing more on social emotional learning and social emotional well-being. And then as an academic, I was curious how people were sort of thinking about social emotional learning and what the research was. And what I found early on in my studies was that the way people were thinking about social emotional well-being was very much from sort of an individualistic background, which came from psychology. And it didn't necessarily resonate with my work and the way I think about education, which comes mostly from care. So I've shifted from talking about social emotional learning to sort of thinking about caring, equity oriented leadership. And that's the position I'm coming from today. And so just some questions that I'm bringing to our conversation is like, what's left out of the conversation on social emotional learning? If we're thinking about social emotional learning as an intervention or as a program or a practice that we're implementing in our school systems, like maybe what's left out or what does that mean and what does it not mean? What current research can help leaders think about caring and social emotionally supportive policies and practices? And then as a policy scholar, I'm always thinking about what policies that's formal and informal promote care, and then how can we care for all students from an equity-oriented perspective? And then finally, how can we create more caring schools and systems? And so I just want to take a minute. Let me see if I can pull up the chat and not lose my slides. Okay, cool. Thank you for weighing in. The care is the glue. Care lies in listening. That's nice. In terms of providing what people need, care in terms of within org relationships, care is meeting a person where they're at. So there's a lot about like kind of centering the care on where people are at or meeting them where they're at. That's really interesting. Honoring a person's complex history. Thank you for that. Concerning yourself with the well-being of others, supporting students. Thank you all for weighing in on that. Everywhere I go, ask people what it means to them. So I appreciate you participating in this larger project. This is how I think about it. This is my working definition that I bring to my work as a scholar and as an instructor. I think about it as an intentional practice and an ethical stance, that it's intentional practices, policies, and structures that kind of weaves together the academic and the affective. When I think about caring, I think about authentic relationships, the collective good, our communal practices, and being equity centered. That was my personal definition. I've also read all the research that's been written on care since 1980. That's a separate paper that I'm not talking about today, but I did a systematic literature review. And this is kind of what I culled from the research, is that scholars are thinking about caring leadership as a set of practices and beliefs that's connected to high academic expectations, authentic interpersonal relationships, and the intentional creation of structures, routines, and processes that integrates the individual with the communal. So that's a cobbled together definition from many scholars, amazing scholars who've been writing on this work for much longer than I have. And I put that out at the very beginning because I think care is an often used concept that a lot of people talk about, but they never necessarily define it. And I think that matters. Also, if you Google care, you're going to get a lot of studies on nursing, which are great, but like not necessarily relevant to what we're doing here. So wanted to put that out there. So I just want to introduce a little bit the research base on care because there is a deep research base. And the first is just to position us in the caring leadership literature, which essentially says that leaders, that is building leaders and system leaders, make a big difference, right? They have been systematically connected to higher student outcomes on a number of different things that we care about. And I put all this together and argue that leaders act as agents of care by creating the conditions for care for communities, families, students, and staff. And the way I think about it is, especially at the school system level, you've got leaders, people who are putting together many different programs and policies, learning standards, allocating resources, inclusion and equity, emergency response plans, nursing, COVID masking and protocols became really interesting in the last 5 years and how schools were thinking about that. So all of this to say is that caring leaders really weave together these many different areas of leadership practice. So we also know from the social emotional learning evidence base, which is deep and I won't go into here, that social emotional learning interventions are specifically linked to more positive outcomes, both academically, so academic achievement, this is a study about 11 percentile point gain, but also social emotional indicators, right? So we've got a lot of research showing that this stuff matters, to summarize it. And when we think about care in education scholarship in particular, there's a lot of great work on classroom care, like what it looks like when students and teachers care for one another in the context of a classroom. That's the bulk of the research to date on K-12 care. It talks about teacher-student relationships, scaffolding academic content, concepts, rigorous content, high expectations, and the like. When you think about school care and what leaders can do to promote caring systems at the building level, we think about social emotional learning programs, some culture and climate data, the relationship between teachers and principals and whatnot. And people are now talking about like mental health days, wellness days, mental health supports for teachers. There's a little less about that. And then this is what I'm here to talk to you about. When you get to the school system level or the district level, and we've got 13,000 organizing school districts in the United States alone, we are thinking about organizational care and how it looks different. There's been very little research done at this level. So we know that it looks different. We know from our colleagues who have done wide-scale studies evaluating social emotional learning interventions that the role of the school district central office is around data, communications, that district activities and leadership directly influence whether schools and how schools take up social emotional learning programs, but we don't know much more than that. So this is where my work picks up. Okay, so we know quite a bit about the field writ large, but we don't necessarily know how the school district can contribute to caring school systems, and that's what I'm particularly interested in. A caution from the research, there are a number of papers and a number of our colleagues in policy and leadership have found that when practices, policies, or beliefs are uncaring, they can undermine care. So you, in a great paper that I highly recommend from 2016 in the Harvard Ed Review, talks about a deficiency of care. Matthias writes this great piece about experiencing herself a sense of lovelessness when she was a student. And then Rosa Rivera McCutcheon writes a book about radical care, and her pieces, she writes about a limiting care. So I just want to say that like there's a lot of great research on what care looks like and feels like for students, but there's also research on what happens when there is an absence of care. And I want to keep this in mind. In one of my pieces, we write about a care vacuum when there's a lack of policies to kind of coordinate care. We also know from the research that students of color have reported less caring at school. So I always share that finding because that really matters. So how can we make schools more caring places for everybody, particularly the students who may experience lovelessness? This is a question I'm asking. And I ask it because we know that there is a care and well-being crisis. These are numbers you're probably familiar with. This is from the Centers for Disease Control and Prevention. We know that the percentage of high school students in particular, those are the students we've been tracking as we've been collecting data, is that the trend for students who are experiencing sadness or poor mental health or suicide, all of those trends are becoming bleaker. So many of us who work with school systems and in schools are really worried about this, which is of course linked to the big epidemic of chronic absenteeism. So putting all these things together to think about what we can do to make schools more caring places. We also know that there's a queer and trans care crisis. This is recent research that shows us that queer and trans students experience persistent feelings of sadness or hopelessness. But the good news is they're much less likely to feel that way if they have a safe adult or a safe person they can go to. We also know that sexual orientation is the leading cause of Latinx students who feel unsafe. So when we ask students to rank what they perceived in terms of what was affecting their safety, sexual orientation is at the top of that. And this is like a great series of reports that GLSEN put out a few years ago. We also know that caring leadership makes a big difference for queer youth of color. Across the different subgroups, I know these are very small charts that I pulled from these reports. We know that Black students, Asian American, Pacific Islander students, Latinx students, all of them report that when they have supportive school administration, they feel better and more cared for. So again, getting back to this idea of like caring leadership, why it matters and how we can bake some of these things in more systemically to our school systems. And so I want to bring us to my work on caring school systems. This is a multi-year ongoing project where I've been asking people and places, how can school systems be more caring? Some people say that's an oxymoron, that systems can't care. I disagree. I think systems can organize for care, can cohere around caring ideas. And that has been a question I've been asking across a number of studies. So just to put us into context here. And Jessica, will you like jump in if there's a question? I can't see the chat while I give
So
these
far,
slides.
so good, but
Great.
feel free
Okay.
to put in questions.
Feel free to put in questions and Jessica will tell me they're there and I will stop talking. So this is a broader project on caring school systems. Again, strong research base on what care looks like in classrooms. Pretty good research base on caring schools. We don't know much about the school district. So this is the project that I've been leading for a number of years, collaborating with other colleagues. And so this is a paper that's forthcoming where we talked to 50 district leaders, myself and my colleague Jeff Walls, about what caring looks like. This is a qualitative study that we conducted in 2021, and then we did an additional wave of data collection in 23. We interviewed people on Zoom and in person, and we analyzed documents. And we were very curious as to, whoops, sorry about that, what caring looks like from a district level. So we asked people in school systems across the country, what does caring look like to you and how do you do it? And what we found from analyzing all these interviews from across these 50 different people across the US was that district care is complex, it is multifarious, it is ultimately relational, which is why I started asking where you're from. It is warm and embodied and about the environment. So when we asked superintendents, like, how do you do care? They were like, well, I walk through schools and I see people. Like, these are the things you would actually expect. The interesting question was, and we asked everybody about equity and equity concerns. They said much of what you all did in the chat. They said it's not necessarily about a particular subgroup or type of student. It's about meeting students and community members where they're at. So that's the finding we call needs driven and responsive. So responsive to their community. The finding that we weren't expecting and that we're writing additional papers on right now actually is around this partnering and politics piece of the central office coordination for care. That is, especially in the wake of COVID, because of the rising mental health needs of students, many districts have been outsourcing care or partnering with mental health agencies and hospitals simply because they don't have the resources, the bandwidth, the money to provide the necessary supports for students in the area of mental health. What was really surprising about this is that you may not be surprised to hear this, but I was. The way they described forming these partnerships was like very informal, ad hoc. Sometimes they had a buddy who was like in the Rotary who knew somebody at a hospital, and there is a sudden partnership. And so we worry about the sustainability of these partnerships over time. I'm looking to follow up and see what's happening with some of these partnerships. The other thing that we found is that, of course, there was a large influx of CARES relief money, the COVID relief emergency money. Many districts put that into counselors, social workers, and nurses. The question now, of course, that funding stream has ended is what are people doing to sustain that? And that's been a question on a lot of people's minds. So these are sort of the 5 areas of district care that we found in the literature, or when we talk to people that will be in a paper that's almost out. So that's how we're defining care, is in these 5 ways. We found some equity implications from this study. We found that there was a greater efficiency and broader adoption of care support. So people were talking about things like their multi-tiered systems of supports, or MTSS, that they were adopting particular programs at different levels of their system to better provide care supports for their students and staff. Interestingly, and we're writing another paper on this, we think about innovation and creativity in this space. We saw little of this. People were essentially responding to a crisis, grabbing a program off the shelf or in partnership with a hospital, and weren't necessarily, maybe didn't have the space to think innovatively or creatively. People in organizational theory and studies would argue that academic standards and curriculum have become so standardized that there's not a lot of innovation and creativity. You might expect to see some exciting local partnerships or local innovations, and we didn't necessarily find that. We also found that in a lot of cases, these school districts who had adopted these, what I call care for all programs, so off the shelf social emotional learning interventions or typical hospital or mental health agency partnerships, tended to neglect the needs of LGBTQ and minoritized students. This is another area I'd like to expand upon. When we asked them, how are you meeting the needs of this particular subgroup, right? And we had looked at the data for the district, so we knew they served a large proportion, for example, of Black students, or we knew they had a particular queer minoritized population group. They couldn't often answer us, or they pointed us towards their equity director. So the ways in which districts are coordinating for equity-oriented care is still, I would say, at the beginning stages. Last year, we added to this growing body of research by looking specifically at high schools. This is a report that came out in the fall. We wanted to know what high schools were doing in the wake of COVID to solve for some of these issues. So we asked mental health workers, counselors, teachers at the high school level in particular, building on our district research, what was happening to provide social emotional well-being or care supports for students. And we found some really interesting things. The first was what many people who've worked in schools know is about the importance of support staff. So in many cases, like a secretary or like a couple of people even talked about the janitor or the custodian in their school was serving as a frontline care worker. Yet we don't have any empirical research really on that role in terms of care. So I thought that was really interesting. We found a number of formal programs that people pointed to as a way they were delivering care. They also pointed largely, this was a high school finding, to student clubs and extracurricular activities. So when I asked them the question of like, how is care done in your school system, for example, they would say, oh, we make sure every student is in a sport, which is interesting. They also talked about intentionally building connections between adults and students in a less formal way than you might find at other levels. And then when we talked about leadership, people at the high school level really felt that the availability of central office leaders during a crisis was key to a caring system. We asked them about routines and practices, and this is all in the report, which is much longer than this one slide. And we found that like regular team meetings, either at the building level or in coordination with the district, were important to cohering care services. Things like advisory or homeroom were important, but not always found. Safe or calm spaces for students, ongoing professional development. Partnerships, again, came up as really important to providing care. And then connections to curriculum, which is a question I get asked all the time. Like, how can we better connect this to curriculum? And a lot of people are asking these questions, and there's no good silver bullet answer right now, but a lot of people are talking about that. I'm going to pause there. I'm about to get into another case and go more in depth. Are there any questions, comments? I can open the chat actually. Hmm.
So we do have a comment, a question in the chat, and I have a question. So
Okay.
take it either way. I'll ask my question first.
Yeah,
I'm apologize if I missed this. Where did you collect those data? Like, was that a nationally representative data set?
it was not nationally representative, although we did have respondents from all of the census regions.
Okay, because I was wondering if there were state kind of contextual factors or state policies that maybe impacted how district leaders or school leaders were responding to the needs of different student subpopulations.
Yes and no. So I do, we have a paper that we propose for ARA next year. I have a whole symposium on care if you're going to be in LA. I hope it's coming through. We have a paper where three of us who have studied particular state contexts, like Puerto Rico, Washington, and Illinois, we're getting together to talk about state policy context for care.
Mm.
The work I shared earlier was a national study simply because getting superintendents to talk about care is really challenging. I would love to do a nationally representative study. That is really hard to do.
For
So
sure.
the answer is yes, the state context did come up occasionally, but not as much as you would think, surprisingly, because we analyzed for that.
Mhm.
And definitely not in terms of thinking about context with minoritized populations. But the case I'm about to talk about was collected in a Western state with many state supports for care. And so that does come up a lot. So yes and
Okay,
no.
awesome.
Great
Thank you.
question. Thank
And
you.
then the question in the chat is from Debbie. It's, have you done research on how care support for teachers affects care support in the classroom?
No, but others have. Others have looked at how leadership actions in particular are perceived by teachers. And what's really interesting is, and I didn't get into this, but I'm going to talk about it right now. There's a really interesting finding in the literature that the way teachers describe care is different from the way students either perceive care or want to receive care. And that actually varies by subpopulation too. So this is like a whole nother paper. But all to say, the way I describe this finding is that caring is contextualized and contrasted. That is, students and teachers actually describe care differently, which makes sense if you think about like the developmental needs of children. 6-year-olds want very concrete things. Teachers think about like warm, fuzzy caring. You know, I turned the lights down and I welcomed all students. 6-year-olds aren't talking about that. Okay. Leaders also perceived particular things that they did as caring, and their teachers, like in the same study, I can send you this, Debbie, if you send me an email. Teachers in the same study were like, that's not caring. I want psychological safety. So there's a lot of really interesting findings we could play with, especially when we think about practice. Like that's why I always ask leaders if I'm presenting to a group of school leaders or superintendents, like, have you asked people what it feels like to be cared for? Do you know what that looks like in your system? And the answer is no. I don't, I study systems. I don't necessarily study teachers. And then trying to link that to care supports is hard, but other people have attempted this and it's interesting. Great question. Thank you. Is there another one? Someone's mentioning Frankel. That's interesting. Okay, thank you for that. Are there other questions? Thanks for the questions. Okay, now I'm going to get to the meat of this presentation. And I want to talk about a paper that came out in May that is a case study of a caring school district. And the school district is La Subida. And I wanted to do some research that would help us reimagine systems of care. So, if we care about care, which I do, and we care about systems, which we know matter, what does it look like to have a caring system? And as you can imagine, these are really difficult questions because many people say systems can't care or systems only do the technical compliance. Okay, so I spent quite some time talking to many people trying to find a school district that lots of different folks from different areas would characterize as caring. I found La Subida. It was a pleasure to research in this area for about a year. So this is a picture from La Subida. There's some things I wanted this paper to do. First, in previous work, I've critiqued the social emotional learning literature for being quite narrow and hegemonic in the way they think about delivering social emotional learning programs. Okay, so I wanted to solve for some of that. Also, for those of us who study school districts, lots of colleagues have written really great things about academics, policies, practices, teacher evaluation, so forth. People weren't necessarily writing and thinking about the system as a place that could care or deliver on caring. So I wanted to think about that through this work. And the research that we do have on how districts implement social emotional learning programs and initiatives is largely atheoretical. It's evaluation work. It's good work. It's great work. It's atheoretical. So I wanted to fix some of these things or solve for some of them or fill in some gaps. And so La Subida has a large history of community organizing. I walked into a great story that I got to collect. Okay, so I just want to be clear about that. People are like, can we generalize these findings? Maybe, maybe not. 30 years ago, through a supportive state grant, they created community service centers, which I found played a really large role in how they can care. Another thing La Subida does well is they grow their own. Leaders and teachers grow up in the community and they come back to the community. And this is ad hoc. It is not like a grow your own official program, but it is happening regularly. And it was really important in the story. And so to this place of La Subida, I brought the theoretical framework from institutional theory that is around institutional work and positive institutional work. Essentially, a lot of institutional work is around larger institutional structures. I wanted to get to the people in institutions, thinking that people have agency. And so I brought in this framework of institutional work, which argues that actors have the agency to change, maintain, and disrupt institutions. So to this great place of La Subida, which I already knew was caring because I spent a long time trying to find it, we asked, how do central office leaders create or maintain well-being and social emotional supports in a crisis? It wasn't meant to be a crisis study, but COVID hit, so it became one. So this was an instrumental case study chosen for their whole child focus. It was part of a larger project looking at COVID-19 response. It was governance, and then it turned into COVID-19 response. And I did these interviews over Zoom and analyzed documents. This is a farm worker community, largely Latinx, really large free and reduced lunch and English learner population. Talked to about 30 people. 10 of those are from the central office. I engaged in a typical qualitative case study process, which you see there represented by arrows. I talked to people, I selected the case, I did a lot of memoing and coding. And so what I found is that there was three sort of processes or structures that held up how La Subida performed care during this crisis. There was leadership routines that were improvised, they mobilized their community, and there was this collective vision of care that I write about much more in the paper. But here's an example. So this is Jennifer, a central office leader, and she said that during COVID, they shifted and now they have student support groups in each of their campuses. Those include administrators and one of the clerks. Remember, I talked about the importance of classified staff earlier. Typically an office worker. It includes members of the team and the counselor and our community service center staff. The idea behind this is whatever is causing a student not to get to class, not to log in, is something that we need to address. So before COVID, before this time when I collected this data, they did not have any teams that went between the district and the school to kind of cohere around caring practices. It was all ad hoc or done by one person. So this was an improvisation. This was something new they started doing during the pandemic to provide care. Something else I found is that they started talking to students and listening to them. This is Tracy, a school leader, who said, "We have our school counselor and our parent liaison come into the meetings and talk to students. The teachers ask questions about how are you feeling about being at home? What do you miss about school? It's been eye-opening to hear what students are thinking, how much they want to come back. They want things to be normal and they miss their friends." So before this, they had not been doing any kind of student focus groups to gather data. So again, this was one of the novel things they started doing during the crisis. The other way that I found that care was sort of delivered, and this started out as a study, is like, what makes us the caring place? And I found out it was many things, which I call multidimensional and distributed. And it was mobilizing their community resources. So they had these great community service centers. Again, these have been created by the state decades before. In some places, they're still thriving. In some places, they are abandoned. It just depends on where you are. And so Isabella was a very involved director of this community service centers. And she said, "This space is a hub of so much more than getting people what they need, and I'm grateful for that. I would hope that everyone who comes through the door feels like the most important person in the world in that moment, because when you come in, you are one of us and we are one of you." In La Subida, I was fortunate enough to talk to nearly 30 people. 30 of them mentioned the community service centers as the place that caring was delivered. So typically, in a community wraparound model, you have like dental services, you might have food. This was the place that really held everything together, and they became so important during the crisis. This is a parent organizer. They had a lot of active parent organizers who told us, this was a focus group done in Spanish, translated back to the English, who said, "I'm advocating for the education of my grandchildren and future generations." So there was a really strong and historical base of parent organizing that everyone talked about. When I would say things like, "Why do you do this?" or "How do you care?" they would say, "Well, the parents asked for this, and therefore we do it this way." And we have these mechanisms in place to listen to parent voices that were quite organized. Again, this does vary by state context and area for organizing. So I want to recognize that. Getting back to your question, Jessica. The third sort of thing that I found in terms of how care was done in La Subida was around this collective vision of care that I heard from everybody. This is Marisol, a central office leader. She was one of the people who had been brought up in the community and come back to the community to serve. And she talked about this. She said, "These men and women were migrant workers themselves. They see themselves reflected in the kids that they teach, and they will talk to you about this openly. So no matter what happens at the top, they remain very committed to the children, and they just keep doing what they were doing." This district had previously been under state control for financial reasons. They had had a number of chief officers and superintendents come in and out of the central office. And what continued the work of care were people sort of, we'd call them mid-level managers and the research leaders and teachers who'd come from the community. So I thought this was really interesting. Everybody, though, espoused this love for place and community. It was really central to how they performed the work of leadership and care. So, what does this mean? I talked to a lot of people, wrote about it. There's a paper. You can read much more about it. The first thing was that the central office leaders themselves, when I asked them about care, relied heavily on these community leadership structures that in many cases had preceded their tenure in the central office, which I found really interesting. The other thing that's really important to this story, and in the paper, I critique some recent initiatives, well-funded initiatives that have been trying to get some of the community service center work going again, and that they give them, a lot of money in 5 years, is that these community organizers and parents had built trust and relationships over decades. This was not overnight or 1 decade or two. It was many decades of work. That trust takes a very long time to build. This started off as me wanting to talk about the central office and care because nobody was, and I think it's really important to study systems. And it ended up being this paper that I didn't intend to write about a community-centric vision of care. So it's really not a top-down story or a bottom-up story, but it's this nuanced understanding of distributed leadership, which includes the community and parents. So our previous colleagues who've written about distributed leadership are typically writing about teacher leaders, assistant principals, and how people in formal positions of power enact leadership. And in this case, I'm really saying that the community and parents were acting as leaders as well. So kind of widening the lens of distributed leadership. Other scholars, Bertrand, Rodella, Ishimaru, have been writing about this for years as well, trying to reconceptualize parents and community members as educational leaders. Ultimately, I think that healing love and these they did talk about a culturally affirming practice as well, were integral to how they did care, what their caring leadership structures were able to be, because as a policy scholar, I'm very interested in routines and structures, came from these beliefs, understandings, and culturally affirming practices that were really powerful. So this was like one case in 1 year. It was a pleasure to do. I wanted to find a caring place to study so I could fill in some gaps in the literature, but it's just one place. I would love to, learn from other researchers who are doing longitudinal or ethnographic work, looking at what a place-based caring looks like. Some of our colleagues who study rural schools have been writing about place-based leadership and place-based care for much longer than I. I did find it particularly fruitful to combine institutional and distributed leadership theories to think about guiding how I analyzed some of what I heard. And then institutional work largely comes from my colleagues in sociology. They write about creating, maintaining, and disrupting institutions. Many of them are writing about businesses, which is all well and good, but doesn't always apply to what we do, which is for a public and collective good. I found that expansion work was really integral in this case. That is, they kind of expanded things they were already doing. So I added that to the literature, which comes back to serving a public good in a crisis. Again, I talked about this a little bit, but community schools are incredibly important. And I think they're being offered to us as maybe one way to solve for chronic absenteeism, for example. They require a long-term sustained investment, not just in the structures, but in parent organizing. I also found, and others have found this large influence of funders and community activists. So thinking about who has access to such structures and who does not, I think is really important. Um, there was a really stable leadership pipeline, but it wasn't at the top. It was at the middle and the school level. So I think kind of recognizing this, concretizing some of this, thinking about making this sustainable requires intentional investment and support. People are very interested in grow your own programs. They had one and didn't even call it that. So I thought that was really interesting. And then they did partner with their local university to hire and bring people back in. So I think, maybe putting more resources into some of those mechanisms would be really important. And when we think about policy relevance and care. In terms of practice, there were some tensions between the community service staff and the central office staff. That is, they were treated differently during COVID, and a lot of them told us about that. The importance of parent, community, and student voice was really paramount. You don't often read or even think about that when we talk about structures for care or system structures. So I want to keep talking about that. And then long-term leadership really did matter for caring and thriving long-term. So thank you for coming with me to La Subida. That's the end of that paper presentation. That came out in May in Educational Policy, and I will stop there for now. Questions, comments?
Thank you so much, Dr. Kennedy. We'll open it up for comments, questions. You're welcome to just speak or put it in the chat. And we already have one in the chat from Raven. Do you want me to read them to you, or do you just want to look?
I can see it now. Thank you I pulled it up. Do you have any thoughts on the impact of care on disciplinary outcomes, or perhaps how care can influence a systems approach to discipline? I have thoughts, and that is I talked about thinking about caring systems work as caring agents for leadership. And I think one of the many things our central office or systems leaders are doing is cobbling together all of these things. So we do have disciplinary outcomes, right? We're all measuring that. We're looking at absenteeism and expulsion in particular when you talk about discipline. I do think caring approaches at the district level influence those things. And some of our colleagues are writing about it. They're trying to attach disciplinary outcomes to what's happening in the central office in terms of interventions. I think those things really matter. I focus more on qualitative work, which it's harder to do influence and impact and outcomes. So I don't necessarily try to go there. But I think when we're talking about a coherence for care, so some of our colleagues, and I've done some work in this area, are looking at instructional coherence. And we do know that when systems cohere around a particular instructional vision, their curriculum materials are aligned, their standards are aligned to professional development and whatnot. Those things cohere, we have better outcomes. I believe the same could be true around care. So when our caring systems and structures in terms of how we oversee mental health staff, how we think about discipline, how we think about chronic absenteeism and attacking that problem, if we could create a coherent caring system, I think those things would shift positively, but I don't have the research on that, and that's what I'm trying to do. So let me know if you want to talk more about that offline. Other questions or comments? Thanks for the question, Raven. I do think it's connected.
Yeah, Dr. Kennedy, I have a question. Thinking about this from sort of a school leadership perspective or like a practitioner's perspective, the district that you described had really for decades sort of built systems that allowed them to care very deeply for students.
Yeah,
But for many districts, they're not in the same sort of position. Maybe they're starting from scratch. They don't have, stable leadership pipelines, some of the things that you were describing.
yeah,
So if you were to describe to a school leader, just to provide them a roadmap, like where do we start? Like if we're
yeah.
really seriously thinking about this, what are some of the sort of first steps that you would suggest for a school district to improve care?
Great question. I happen to have a set of slides to get to just that. Thank you. No, I wanted to bring this work back down to the work of caring leadership in schools right now. So I put some of my findings and research into a set of strategies that I'm going to share with you right now. So thank you for that. I think when we think about strategies and practice, there's principal individual practices, there's building level collective practices, and there's district and system practices. I want to talk about each of those. These are recommendations called from my research and my reading of the literature. Okay, so the first thing is to put care on the agenda. I think if you asked some people in La Subida, they would not say this is a caring system. I asked the questions and I put it on the agenda. And they had a department until it was disbanded because of politics dedicated to care. So, what I would say is that we have so many meetings that are dedicated to like discipline, standards, testing. When was the last time you put care on the agenda? I think that could be really powerful. And that's what we're doing today. So thank you to Texas Tech and Jessica for Debbie for bringing me in to even talk about this. So put it on the agenda. Set aside time and space for it. What does it mean? I have a really great story about that. So I interviewed, 50 people across the country. My colleague Jeff and I did. And I was talking to a superintendent of a district that had in their mission care and love. And I never see that. And I always analyze like the website and the materials before I talk to somebody. So I said, tell me why care is in your mission. And he's like, I'll tell you why. The first day back from summer break, convocation or whatever you call it, where you are, I had all my teachers get together and talk in small groups and say, why do you do the work that you do and what drives you every day? And then they put it into like a word cloud and they came up with this statement from the teachers' voices, right? So that's really powerful. That's theirs. It's not ours. It's not mine. It's not top down. It was theirs. Second great story. I had the great fortune of doing research work in Long Beach a few years ago. Long Beach is always lauded and like wins awards. Great system. It is a great system. And I talked to lots of people there, and they have like this. They have this framework for like 6 things that everybody does in Long Beach, and they actually like when you talk to them, they really talk about it. Like this is pillar 3. In a lot of places it sits on the wall and nobody talks about it. Okay, pillar 6 is about care. Caring in the classroom, caring structures and processes. And I was like, you guys, I never see this. Where did you get this? And they were like, well, we talked to our African American students who didn't graduate. And we talked to our African American students who did graduate. They're very interested in closing the gap around graduation with their Black students. So they brought them in for listening sessions and they said, what made the difference for you, the Black students who graduated? They all pointed to caring teachers. So they made that into a structure and a routine and a practice by making it the 6th pillar of their understandings framework. I think that's really powerful. So we ask, we listen, we put it on the agenda. The other thing that I want to point to is that when it comes to, whoops, didn't mean to switch. When it comes to care, the way educators described what they needed from their leaders was in the moment, informal, responsive care. They didn't necessarily point to like the beautifully written newsletter that came out every week from their assistant soup. They remembered when somebody showed up for them in a time of crisis. Superintendents also named caring strategies as like just being there, embodied. I think we don't talk about that enough. We've become like very empirical, research driven, but being there matters. So I want to say that. The other thing I would like to add is that in places that have taken up social emotional learning indicators or well-being indicators and really used those to make a difference, they're adding those to their data meetings. So people have become very comfortable being inundated with academic data and they're responding to the benchmark assessment. Are we doing the same with our affective data or affective data? We're now collecting lots of survey data. What are we doing with it? Lots of people are collecting it. I don't always find that they're using it. So those are three concrete principal leadership practices that I pulled from my research and I would offer back to the community. In terms of what we can do as a collective at the building level, right? So we're still in the school building. When I talk to mental health workers who have now become integral to the fabric of care in schools, and we've hired many of them in the wake of COVID, right? These are your social workers, your mental health workers. They are often not involved in those multi-tier system of support meetings. They're left out. Maybe because they're from the county, maybe because they're classified differently. I don't know, but they're like, I care for these kids. I want to be part of the decision making. So widening the idea of like who can be on these teams, I think matters. I also want to say that setting aside intentional time for care and caring practices, whether that's an advisory, whether it's in homeroom, whether you're making sure everyone's actually involved in those clubs that you say are how you do care, I think those things matter. So can we get together as a collective and examine some of that? I also think that partnerships are how we're doing care, especially at the high school level with students with high mental health needs. Are they thoughtfully connected to the school day and the teaching staff? Sometimes and sometimes not. So I think evaluating and having conversations around those three kinds of practices might be instructive to schools and school leaders. When we think about the district system, as I do, because this is coming out of the Caring School Systems Project, I think the first thing I would recommend to system leaders who want advice is to distribute caring leadership. In many places, there is like one person who is in charge of social workers, counselors, nurses, COVID protocols. I mean, I could keep going on and on. Literally, I ask people to list all the things they're in charge of, and sometimes I can't take notes fast enough. These things need to be distributed. I've talked to more than one person now who has completely lost their care work because the person who oversaw that grant at the district office retired and nobody picked it up. Also, not surprising, it's mostly women. So what can we do to distribute who is in charge of care to prevent churn and precarity, especially as grants come and go? There's no title for care. There's no title fund for mental health. So these things matter. The other thing I would offer to system leaders is to speak up. Surprisingly to me, because I'm a cynical ex-teacher, people at the school level actually mention their like pillars and practices, their missions and visions, the superintendent's messages. I mean, those things actually matter way more than I would have predicted. Okay. So when you speak up, superintendents, and when you are there in a crisis, that matters. I would also say, third recommendation, put care in your strategic plan. Sometimes those are living, breathing documents that change practice. Sometimes they're not. I can't tell you which one yours is, but when it was in the strategic plan, it gives building leaders and teachers cover to do the important work of care. So those are three kind of concrete practices I would recommend to system leaders. We've got 10 minutes left, so I have just a few more words if you'll indulge me. I am always thinking about more caring schools and systems and how we can get there. And so I kind of urge you to join me in asking this question: is how can we in our work as instructors, as practitioners, as researchers, as scholars contribute to creating the conditions for care through both individual activities, that is like how I show up in the world, and our collective actions? That's something I'm still working on. I'd love to hear from you how you're doing that. These are two books that I like. You might find them useful if you work with leaders or you are a leader. One is by Smiley Murphy and Seashore Lewis. They wrote a book on caring school leadership. It's lovely. The other is Rosa Rivera McCutcheon's great book on radical care, leading for justice in urban schools. These are two great books, Until I Write Mine, that I recommend to you. Good reads. I also have a number of articles freely available and paywalled empirical and practitioner and policy relevant on these topics if you're interested in reading more about the things that I said very briefly. And so I just want to close by adding that I think hope is a really important caring leadership practice. We are living in a time of difficulty and chaos, and some of us are seeing our institutions crumble and our sense of academic freedom be trampled. And so I think that in a time of chaos and heartbreak, which we're experiencing right now, we need to pay renewed attention to care. I would also encourage us as a community to think about a collective care that can help us move beyond the here and now to what's next. And I really do believe, and I've seen it in the literature and I've seen it on my own work, that caring leadership strategies can be impactful for both well-being and academic outcomes. I don't want to lose that piece. In fact, they found that in places where students perceive that they are cared for, but there aren't high academic expectations, they don't do as well. So we need to put those things together. I just talk about the care piece more because we've got lots of folks doing really good work on academics. So with that, I would love to hear from you. I'm going to turn off my slides so I can actually see everybody and everything. What ideas, hopes, practices do you hope to implement? Questions, comments, I would love to hear them. So I'm going to stop my sharing. Thank you for indulging me as I talked about
Thank
one of my
you.
favorite topics.
This was wonderful. Thank you so much. I think we have time for maybe one or two kind of final thoughts or questions. If not, I'll ask my question. Oh, Christine. Christine, you're muted.
Christine, I
Christine,
can't hear you. It looks like you're saying important things.
just go into the chat. No worries. I'll ask my question, Christine, if you want to like type your question. So I was very interested when you kind of framed teacher preparation as part of like an agenda of care or care work at the district level. How do you see this type of work fitting into a context where like teachers, I think, are sort of in a state of crisis in many cases, like very underprepared, overwhelmed, overworked? What does that look like?
Mm-hmm.
Mhm.
So I love this question. This is something I worry about every day. I've got three children in three different elementary, middle, and high schools. So I think about this all the time, both as a person who works with educators and a parent of kids toiling under educators. The first thing I want to say is that until very recently, care has been the presumed job of teachers, 90% of whom are women. So
Mhm.
there is a lot to be said for the gendered notion of care work that I find intensely problematic. And even when I talk to people at the central office, they'll go, "We hire caring teachers." I'm like, "That's great. What are you doing to provide the structures, routines, processes, mechanisms, scripts, words to support them so they don't have to take all this on themselves?" And if you interview teachers and if you listen to them, they will tell you what they need. So I worry about this greatly. And I think a thriving, coherent system, and we know this, there's research on this from instructional coherence, that in places where teachers feel that there is a coherent instructional system and they're not being asked to do 19 different things for 19 different people, they feel better about their work. So that's
Mhm.
one thing we could do. We could create instructional coherence and care coherence by providing a system of supports and resources and share those with them by saying it's not only your job, it's my job too. And by the way, what can I do for you?
Yeah, that's great. Thank
I,
you.
I think even shifting a mindset about what is the job of the school district central office. A lot
Mhm.
of people, especially our cynical scholar colleagues, would say their job is compliance, their job is legal, right? And their job is technical, the technical core. We love talking about the technical core, sure. But what brings so many of our loving educators into buildings and keeps them there is a care for students and community. So, what are we doing at the systems level, at the scholarship, at the research level to take some of that pressure off of people toiling in schools and kind of feed into that caring system that keeps them there. So I would argue that to be an agent of care is the main job of a central office leader, and that includes high academic expectations.
Who are
Fantastic.
the best mentors or the best mentoring resources for district leadership as far as care goes?
Like if they wanted to do more work on care,
Yes.
what should they do?
Yes.
Well, those 2 books are great.
Mm-hmm.
I'm happy to talk to them. I mean, it's a good question, Debbie. I know the AASA has a number of different cohorts around like urban leadership, and some of their cohorts and groups have explored social emotional well-being. I've spoken with a number of them, so it's of interest. They also tend to rely on each other, these superintendent networks. So,
All right, and Christine did add her comment to the chat, just amplifying and supporting your work and your findings.
thank you for sharing that. So you've felt the leaders working together to provide a better climate for students. Yes. So a coherence. You can sense when things are cohering. Yes. So Debbie, I've been working on this tool called a caring audit, where we think about looking at a coherent caring system. We think about discipline, chronic absenteeism, counselors, mental health workers, nurses, all of the people, practices, and programs that would go into a caring, coherent system, and sort of doing a kind of audit, not an evaluation necessarily, but thinking about what do we already have in place? Because lots of systems have all these pieces and parts. They haven't necessarily cohered them in the way you're describing, Christine, which I find incredibly inspiring. So thank you for sharing that. So that's one move I would urge superintendents to make, and that's a tool I'm working on.
That's great. Well, I would like to humbly suggest we end on a high note, which is Christine and her witnessing these ideas in action. So, Dr. Kennedy, I just want to thank you again for joining us. This is such a delight to learn more about your work and has definitely encouraged me to think about some of my work in new ways. So thank you for that.
Thank you
And
so
thank
much for
you
having
everyone
me.
else for joining us.
It's been a pleasure. Thank you all for coming. Have a good rest of your day.
Thank you, everyone.
Bye.